Terry was a fairly typical patient with heart failure. It's a chronic disease, and he had known cardiovascular disease for quite a long time. I think he had suffered his first heart attack when he was a relatively young man. Did okay for a number of years, ultimately required coronary artery bypass grafting or bypass surgery. Again, did okay for several years, but ultimately developed more progressive fatigue, shortness of breath, and then ultimately came to our attention at our collaborative heart failure transplant program up in Maine at Maine Medical Center. And at that time, we felt that it was necessary to move forward and think about whether there was anything further that could be offered to him, specifically either a heart transplant or some form of mechanical circulatory support or ventricular assist device. I met Terry at an outpatient visit up in Portland, Maine, and as soon as I met him, it was clear that he needed to be admitted to the Brigham. He came down and underwent a fairly urgent evaluation for therapies beyond simply the medical therapies that he was receiving. He had developed a problem within his lungs called pulmonary hypertension. So the pressures in his lungs, in the arteries in his lungs, had been elevated over many years because of his congestive heart failure. Patients with moderate or severe pulmonary hypertension generally don't do well with a new heart initially because a new normal right heart can't pump against those high pressures. So at that point, really, the other therapy that we had to offer him was a more permanent left ventricular assist device to take over the function of his left heart as a really permanent form of therapy. He moved very quickly to surgery. He actually did very, very well. He had a very uncomplicated post-operative course. Was back on his feet fairly quickly, working with physical therapy, and then really the focus became really his strength and nutrition, because both of those were really limitations before surgery. Ultimately, he went home, I think, within a month after surgery. We now follow him along with all of our ventricular assist device patients on a monthly basis, regardless of where they live. And really, he is back to a fully active life. There are numerous issues that come up on a day-to-day basis in these patients, whether it's related to the pump itself, whether it's related to some of the hardware that's required to maintain the function of these pumps. And I think given the fact that the technology is constantly evolving, it requires a support team, nursing and non-nursing support staff who are constantly having to re-educate themselves about the care of these patients, learn about new devices, and but that also makes it fun as well, because it's new technology that we can offer to patients that ultimately provides the support they need, really, that previously wasn't available. After surgery, it does take initially a week or two simply for the patient to recover physically from the operation, and then there is about a 1 or 2 week period in the hospital where there is intensive education that goes on between our staff and the patient and their family on a daily basis. Actually, the Brigham is unique in the fact that we have a support group actually that meets once or twice a month that gives the opportunity, provides the opportunity for patients and their families to meet with each other, to talk about some of the challenges that they've encountered and share some of the things that they've learned with other people undergoing this type of treatment. We also have patients with VADs come and try to visit patients in the hospital before their surgery to talk to them a little bit about what they might encounter and what they can anticipate after surgery when they go home. It's clear now, looking forward, that patients are going to live longer with these devices and do better with them.